Namaskara and good evening, one and all. Ladies and gentlemen, it is my privilege to welcome you to this session on health, a program to decode healthcare, health being equal to mind, body, and soul care. This is a program which has been hosted by Success Studios, a wonderful platform and an organization which has been taking mentors on board to showcase their achievements and to be inspiring many other people to be joining the bandwagon. This program has been pioneered by Dr. Ms. Sonali Dutta Baanerjee, who is also one of the panelists. I am Vikas Saxena. I am the Chief Executive of Professional Expertise Group, and I am privileged to be the moderator for this particular program. We have a major constraint, as always in such sessions, it being time. So what I'm going to do is I'm going to request all the panelists to give a crisp and a concise introduction of themselves and to share their perspective on this particular subject. To begin with, I would like let me introduce briefly speaking, the panelists whom we have got on board here. Dr. Sonali Dutta Baanerjee, she's a mindset coach, an accomplished soft skills trainer. Dr. Vasudha, who's an Ayurvedic yoga specialist. Dr. Ajay, who's an anesthetist. And Dr. Swati, who's a dentist. So over to Sonali. Sonali, can you please introduce yourself?
Yes.
And share a crisp and a concise perspective on this particular subject, please?
Right. So thank you so much for this opportunity, and of course taking time out to be on this show. We are really privileged to have each one of the specialists on this show. It's been our dream for a long time to support all our viewers and also participants with a view on healthcare. With regards to my domain, I actually specialize on psychology and also mindset and growth coaching for senior leadership and the board members. It's been a long time in the industry, almost for 30 years that I have been there. And my biggest experience has been that people who are able to control and operate their mind well, not only enjoy great leadership, but they enjoy great health. So I'll take this opportunity to quickly talk about few things that one can do in context to really building a mind, body, soul approach to holistic health and holistic living in life. With my experience in the industry and also with professionals at large, it has always been my privilege to see that people who on a regular basis have a very spiritual approach towards interaction with other human beings. This is especially critical because as leaders, we come across different kinds of people, and sometimes it becomes very difficult to understand the mindset of other people or to accommodate the mindset of other people and work as a team. So I always advise all my coaches and mentees and people who come to us for various kind of senior leadership operational issues that on a day-to-day basis, please meditate so that you calm your mind and take a stock of things, of how things are happening in your overall life, because personal life always impacts our professional life. Both of these things go hand in hand. So unless we are able to moderate these two things very aptly, it is difficult to manage a good health and a good leadership capability within the organization and within the family as well. I think one of the things that I've always covered with my coaches is that regular holistic healthcare is very important. Whether it be, I'm sure my panelists here, all the doctors who are from the medical world would be talking about the various steps to take in terms of annual health checkups. Whether it is dental, we have Dr. Swati, who I have experienced for a long time. The reason why we desired to have them here is not only when you have a problem, you visit the doctors, but you visit them proactively to ensure good health. Then we have Dr. Ajay, though he is in a specialized zone, he has always been a great mentor when it comes to keeping good health. And not only in such cases, he has also advised. I've been very privileged to have him in our kind of journey of life, because even when I had a challenge in life with healthcare, he was the person to step in and advise us how to handle it, which doctor to go to, and what is the long-term kind of approach that we should have. So, of course, then we have Dr. Vasudha on the panel today, who is a specialist in Ayurveda and yoga. And I have been part of her yoga certification. And I think that has given me a huge mental discipline to not only practice yoga every day, but to understand how it plays a role in our regular health. So with that, I would like to sum up by saying that, please take advantage of this amazing panel for your regular body and healthcare and eating habits and your discipline in life. And with regards to your mindset, there is one principal rule that which I always say is this, that something which is empowering you, something which is making you happy and satisfied about life, indulge more in those activities. And something which is taking you down or depletes your energy, delete those activities from your life. So this is very, very critical, because in mindset control, it plays a humongous role when it comes to how you manage your day-to-day living. Are you engaging in too much negativity, too much beating yourself up because the results have not happened as per your expectations? Or are you taking the brighter side of life, the silver lining in the cloud, and making yourself more and more active with whatever is going right? So I think that's my 2 bits when it comes to healthcare from a mindset perspective. Of course, if there is anything else, I'm happy to respond to and answer. And of course, our coaching sessions and our mentoring sessions, and like Vikas mentioned earlier, that if you want to reach out to Success Studios for all the specialists and experts, mentors that we have, please feel free to do so. Over to you, Vikas.
Thank you, Sonali. I'm very appreciative of the fact that you have given an insight into the kind of work that you are doing, and you have underscored some very vital points. I understand that in the current session we would have to be very crisp and concise because the time being the biggest challenge. I will request Dr. Vasudha to throw some light on the domain that she represents, and to give us an introduction about what she is currently doing. Over to you, Dr. Vasudha.
Thank you, Mr. Saxena, and thank you, Sonali, for having over. So, Dr. Vasudha Sharma, I am the Director of Medical Services of a chain of integrative medicine centers called Vivekananda Health Global. So, we basically work in the field of Ayurveda, Yoga, and Naturopathy, and bringing together the best of all the three for the best treatment outcome. And of course, I am also a clinical practitioner otherwise with over 20 years of clinical experience. So with this brief note, I would also like to share my presentation and keep talking. I would request Dr. Ajay to please stop the screen share. Sure. Thank you. So what we're trying to understand today, I appreciate the step taken by Success Studios to say how is immunity going to impact different people's life, and then what can we do at the level of different other systems which are prevailing in the present field of medicine. So with this understanding, my focus will be mainly on Ayurveda and some on yoga as well. So as we know, there are many other healing disciplines such as Ayurveda, yoga, and these are our traditional systems of healing which originate from India. Ayurveda takes its root from the Vedas, and similarly yoga also takes root from ancient texts which are called darshanas. And Maharishi Patanjali was one of them, really brought them into the practical life, and then really spread this knowledge over again. And when we try to understand how Ayurveda can really help in managing ourselves, whether it is preventive health, whether it's curative health, when we say that, it is basically prevention or disease management. So the basic principle of Ayurveda also talks about it. Either a person is, ill, so we're trying to treat the illness, or the person has no illness, and therefore we have to prevent the illness. And that's the major way in which the science also deals with the subject. So when we talk about this, the basic principles of Ayurveda, are large, but then we are just going to touch base upon a few things, saying the body humors, which are the Vata, Pitta, and Kapha. You have the digestive fire, the most important component of Agni as per Ayurveda. Then you have the dhatus, the malas, or the tissues and the excretory products. Then you, of course, have the Atma, the Manas, and the Indriyas, which are the soul, the mind, and the sense organs. So I will explain the concept of definition of health. And it also says, Samadosha Samagnischa Samadhatu Malakriyaha Prasanatmendriya Manaha Swastha Itya Vidhyate. So this definition has been brought forward even in modern medicine after a very long time, where they included the mind-body complex in it. So what defines health is just a state of being physically healthy, but mentally, spiritually also being healthy. And a lot of preventive healthcare mechanisms have been explained, and one of them is Dinacharya, which is your daily regimen. What are you supposed to do right from waking up in the morning until you retire to bed? Rutucharya focuses on seasonal regimen. So now we say we have the rains here. So in the rainy season, how do you maintain your health? What is the diet you follow? What is the lifestyle you follow? Based on which, you can really keep up your health and improve your immunity. And then Sadhrutta is where we talk about the moral code of conduct. How are you supposed to really socially live as a good human being, and then start imbibing those moral abilities, which are very, very essential for an individual to grow. Because this is also very important to keep yourself positive, because mind plays a crucial role in positive health. Now, when we just look at simple aspects of Dinacharya, it starts from, say, early raising in the Brahmi Muhurta to other aspects, which talks about, say, cleansing processes and, different other processes such as Nasya, Dhuma, Abhyanga, which is a daily massage, which is recommended. Then you have different processes of eating and what else you do, and then, you retire to bed. So much is an elaboration that at every level, we can guide people how do they really keep themselves healthy. And the concept of Sadhrutta is also very large. So this is just, to understand what all it covers: your mental, social, spiritual, personal, moral, and religious conduct. And when we look at preventive health, so, we speak about oral, maybe herbal supplements, maybe, some medicine or polyherbal combinations, which are called as rasayana, which actually are rejuvenating medicines. Similarly, you have the other aspect, which includes some external therapies. So when you look at Ayurveda, many of them, denoted to very simple procedures such as Shirodhara, like you can see in this picture as well. But there's large therapeutic benefit of it too. Preventive health, yes. And otherwise also, we have, different other health problems which can be treated using such procedures. There are different other procedures of Ayurveda, such as, say, fermentation therapies using medicated leaves and herbal powders. Then you have different other therapies. It could be for spinal health, for skin, hair, and much more. So what we need to understand here is so many procedures are available, which definitely are curative, but they can also be done on a preventive angle, because keeping your respiratory health well, keeping your circulatory health good is all an essential part of total upkeep of health. And obviously, in today's life, stress is such a key role to play in manifestation of different health problems, and also, in seeing that stress responses are there, but then yes, the impact of the stress on our body can be minimized as much as we can. So we also saw this in COVID, that people got so anxious, and anxiety itself is one of the cause to reduce your immunity, and therefore stress has to be managed, and they offer great solutions. And when we know that the body's response to it is also to induce problems, therefore we need to prevent them. So it's very essential to understand this particular component of how the brain responses change when there is stress response as well, and how do we really start working on reversal of the same. A very simple example is many people are getting pre-diabetic nowadays. So if we take stress as one of the major cause, then we know that yoga can offer a very good stress relieving mechanism. And Ayurveda diet, in addition to it, Ayurveda procedures, like I was just explaining, can all slowly start adding on to the reversal, and therefore the baseline of the blood sugar can slowly be reduced, because what we see as an increase in cortisol can slowly induce an elevated blood sugar. We work backwards. This is just a very simple example to kind of just relate to the subject. And Ayurveda also, defines, explains immunity, stress in its own methodology. So when we specifically talk about immunity in Ayurveda, they classify it into different types, which is called Sahaja Bala, which is natural or the innate immunity. Alaja Bala, which is more to do with seasonal, age-related, because it varies from person to person. Yukti Krita is that which is modulated through diet, lifestyle, your daily regimen, your immune modulators, and much more. So overall, what we need to understand is positive health, immunity, where we are trying to improve and strengthen the host immunity by following different procedures like I just discussed. And here, I would also like to mention a couple of herbs which are very commonly used, and nowadays, especially during COVID, and now we're still in the COVID phase, but we still feel we are in the post-COVID phase, right? So herbs such as ashwagandha have been researched extensively, and the potency of the herb is very well understood. It specifically can work on activating lymphocytes, therefore it can improve your immunity. Similarly, you have guduchi, which is Tinospora, a very, very well-known herb which is grown in homes as well. It's got a very good anti-inflammatory effect. It's an anti-infective as well. And you have Yashti Madhu, which is Jesht Madhu, very commonly used in households, once again, has a great anti-inflammatory benefit. And Amlaki or gooseberry is very well known, especially Ayurveda, when everybody says Chavanprash. So what is Chavanprash rich? It is rich with gooseberries, and that's where the whole immune modulation property of Chavanprash is so good. It, of course, has different other herbs as well. So overall, when we start understanding, these two systems can work for all age groups, be it a child or be it an elderly, and therefore the family can use. People need to explore more on the same and definitely understand that this holistic well-being at different levels, physical, mental, social, all this is very, very, very crucial. And therefore, a simple takeaway I would just like to give is people should understand that you should not suppress your signs and symptoms. Your body starts reacting or shows signals. Do not neglect them. Understand what signal your body is trying to give and work on it, because preventing problems before they become big is very essential. Otherwise, you have to spend a lot of time when you're ill than when you get to being ill. And understand, therefore, that food itself is a medicine. Food itself is healing. So taking junk food, outside food, fast food, and every weekend, people want to go out and just have food. So these kind of methodologies will not work well for us. And similarly, when it comes to yoga, it's just not about practicing yoga 10 minutes a day or just doing asanas or just doing pranayama. Yoga is a holistic science, and therefore it has to have the right dosage. Like we have dosage in medicines, yoga also needs the time and effort, and but it will really help you to stay positive, stay healthy, and also prevent different other health problems from affecting you. So overall, when you look at the physical aspects, these are all extremely important. When you look at the psychological aspects, one major aspect everyone should probably imbibe is a let go phenomena. I'm always carrying the negativities which somebody has probably probably got angry with me, had some problem with me. But who is the person who is going to get affected? It is me. So I have to let go. this is what I would, overall like to say, and kind of close my presentation for today.
Yeah.
Thank you very much.
Thank you, Dr. Vasudha. I would request Dr. Ajay to give us a perspective about the domain that he represents and to briefly introduce himself. We have a very limited time, and so we like to make the best of it. And It's very important that we hear the panelists. And Dr. Ajay, your contribution to this program is going to be immense. We would like to hear from you.
Thank you, Vikas. First of all, I would like to thank Sonali for giving me this opportunity. And I don't know many of you are knowing or not, but Sonali is a long distance runner. And in fact, we met that way only. We met on a road while running, and then we became very good friends. So anyway, so just sharing my screen. Okay, share. Fine. So without wasting any time, so
we just have 7 minutes. So I thought
So actually, my topic will be little deviation from your main topic. First, I thought of talking of post-COVID stress, but I found there are many speakers to talk on that. So I thought that let's utilize this opportunity to solve basic myths about immunization, or rather I'll say just a clinical part of COVID, because still we are not out of COVID phase, I'll say. So just few 10 FAQs. Is COVID really dangerous? I'll say yes. Really, yes. Actually not seen that part. I am working in ICU for last 1.5 years, and up to last month I had 30 patients in my ICU COVID. I'll just give one example. Like there was a family in my ICU where old father mother was there, and there are 4 children, 2 daughters and 2 sons. All are in the age of 40 to 50 bracket, and the net result was the old couple survived and all 4 children died. So it's really dangerous. We cannot, you can say, just undermine the severity of COVID. Second, is Delta virus more fatal than previous Alpha and Beta variants? I'd like to say yes, definitely yes. Then is the third wave expected? We can't say. It has been there in many countries, so we can expect in India, and that way we should take our preventive measures as much as possible. So still I can say yes, although not sure, but yes. Is there prevention? Yes. The only prevention is vaccine, and vaccine. So whatever it may be, I am really sorry to find some of even educated people. I found many that they still not get vaccinated. So vaccine is the only solution to fight this COVID. Then very common questions we get: does Pfizer better, Moderna better, Covishield better? Trust me, no vaccine is better than other. So I'll say all are actually equal. So there is a lot of conflicts you will find in different newspapers, and nowadays that social media drives you crazy also with so much of the good or bad information. So trust me, all vaccines are equally effective. Whatever vaccine you are getting, you should get it. Now, all vaccines are effective against Delta virus. That is again yes. Full articles you will see that Covaxin is better, Covishield is better, Pfizer is effective. No, all are effective against Delta variant also. Now, what should be the gap between 2 doses? With the Covaxin, it is 4 weeks, while with Covishield, it is 4 to 8 weeks. This one very common question: if I had COVID infection, can I take vaccine? Yes, you can. But after how long? A gap of 3 months is must. 3 months gap should be there. Now, another issue, a lot of myths and rumors were there that the people who received COVID died with clots. So, yes, so as such, you need not worry. But yes, if you have clotting disorder, then vaccination is contraindicated. You shouldn't take if you are a proven case of clotting disorder. Another very important controversy: pregnancy or lactation. Now, this again remains controversial because there are many recommendations, like WHO recommendations are different. Gynae Association of India is different, World Association is different, but pregnancy and lactation, they say It's your individual risk. Individual risk. So pregnancy and lactation, there has been safety. There are so many ladies which has taken, few are very known to me, and they have normal birth and no consequences, but still they say there is no proven studies, so it's up to you. So I still prefer better you go for. Now another very common query when it comes is, if taking this because the result may come positive and they have to travel or something. No, the result test virus and vaccine produces antibodies. So your result will be positive for antibodies, not for the virus. So you can take it. So I think that is enough. There are numerous questions still. If someone asks to ask me anything, I may help as much as I can. So I think that should be all enough. That should cover most of the queries. And again, thank you very much, Sonali, for giving me this opportunity. And back to Vikas.
Thanks a pile, Dr. Ajay. I will request Dr. Swati to give us an insight about the particular domain that she represents and the challenges that she has faced as a dentist. I think as a dentist, the challenges would have been enormous, because imagine I'm impressed trying to visualize a patient coming, and opening his mouth or her mouth wide. And I think, she will perhaps bear me out. The dentist has perhaps been the most susceptible health worker, in the entire profession. I may stand corrected, that's fine. But I think, it's always the distance that gets reduced, between the dentist and the patient who's there. Am I right, Dr. Swati? Dr. Swati, over to you.
Good evening. Thank you, Mr. Saxena. Thank you for, understanding the situation, the current scenario, and understanding. Like to thank Sonali to invite me in such a good across the counter. People generally don't give as much importance to the oral health as they do to all other aspects. So good evening. I'm Dr. Swati, and I'm the clinical director of Krishan's Dental Clinic. And I call myself a tooth healer, not only a dentist, because I believe in healing. Because treating is different from healing. I heal people and their teeth and their problems. So I specialize in lasers, and I also basically specialize in treating special needs children and also the older generation using the lasers. Well, now, Mrs. Saxena, I would personally, just very shortly touch upon your aspect. Yes, dentistry has been majorly affected by COVID. Firstly, the first 2 months, I had actually shut down my clinic completely, because it is scary. Because when the patient walks into your clinic, he's off the mask. You don't know whether he's an asymptomatic carrier, whether, he's had COVID, because, sometimes people do not give a correct history as well, whether they have come in contact. So it was really scary. But, the good thing is that, you can actually, if it is like touch wood, I've been practicing now, and all the precautions have been taking. We've been sanitizing the clinic before and after each patient. I've been wearing a PPE all throughout. And, the patients also, we actually make even the patients wear the protective gear. And I'm on with a face shield, vaccinated, as rightly, Dr. Ajay had also mentioned. So that all that has actually helped, in building the practice and getting the patients back, and, even our safety, because even we have to come back to our family of children, of parents, and everything. So, with our multivitamin supplements, making our immunity strong. And that way, touch wood, by God's grace, this time has passed, and we have been able to give the services also which have been required. Because actually in the COVID times, we've actually seen that because of the stress, because of the medication, people overloading themselves also with medications. There have been a lot of issues that they are facing in terms of the oral health, not in terms of cavity. Actually, to be honest with you, there have been much lesser cases in terms of cavity, because, people are very conscious of what they're eating. But because of this COVID anxiety, there has been a lot of gum issues that I've been seeing in people. People are not stepping out in the sunlight. There's been a deficiency of vitamin D, etc., which is again, taking a toll on their oral health. Okay, so this was just something which I really just wanted to briefly touch upon, Now, coming back to my field, that is the oral health. Well, oral health is a multifaceted, and it includes the ability not only to smile, but to speak, to smell, to taste, to touch, chew, swallow, and convey a range of emotions through facial expressions and confidence without any pain, discomfort, or disease. Now, most often people actually believe that, teeth are just required for your looks. That's not true. Apart from the looks and aesthetics, teeth also play a very important role in eating. Now, obviously, we all know that, we eat, we chew. When you chew the food actually gets mixed with your saliva, which is because of which you're able to taste your food as well. And the digestion of the food begins from your mouth. So obviously, if you have oral health issues, you will not be able to eat right. Okay, there would be a lot of associated, diseases or other health issues which may crop up if you do not take care of your oral health. Now, what happens is that there could be a gastrointestinal disturbance which would occur. Obviously, if you don't chew, if you just gulp your food, there would be more number of acids which would be produced. They would again cause an acid reflux in the mouth, and the teeth, the outer layer, which we call as enamel, has got calcium carbonate that would get eroded. It was cause erosion and a lot of other things. There would be sensitivity, and which would again make it difficult for a patient to eat normal food. So again, the nutrients are not absorbed in the diet. The patient would have to stick to a soft diet. There would be problems like constipation. There would be problems where a person is not able to chew. Hence, all the essential nutrients which are required for your health, they are not obviously absorbed by your system. So that takes a toll on your health. So, oral health is also as important as that. Plus, even your oral health, I don't know how many of you are aware, but, it also plays a very important role in the speech. People who do not have, older people, if you've seen, who've lost out on their teeth, their speech is not very audible. That's because there is air passage. Okay, usually we are able to speak because, there is air resonance which happens and that produces speech. So, and the movement of the tongue against each teeth, it produces various sounds. So teeth also play a very important role in your speech as well. And of course, in a person's mental health in terms of confidence, if you have good looking teeth, if you have, strong teeth, you are a much more confident person. And of course, it helps in building up a person's personality. So this was the importance of the oral health. Now there are a lot of conditions which, can be, which is evident just by looking at the oral health of a person. Now, a young person coming into our clinic, maybe in the early 30s. Now, suddenly we see that he's got spongy gums and he's got a very bad gum infection, maybe even loose teeth. Now, this clearly indicates that it's not only the oral health, there's definitely some other underlying, health issue which this person has. It could be an uncontrolled diabetes. Probably there could be some other immunocompromised, compressed situation. And, there could be a lot of other health-related issues which basically, get reflected upon as an oral problem, as an oral manifestation. Now, a few of those problems which are like, gastrointestinal problems, like I already told. Then even people who suffer from epilepsy, they also have got other, oral health related problems, like, maybe their teeth are chipped off, they've got gum infection because of the medicines which they take. And, there are a lot of, now because of COVID, there is a lot of anxiety, depression, sleeplessness. So all of these impact your oral health, because people take medicines. There could be insomnia that they're suffering from. So people are actually taking medications. Because of this medication, what happens is that the gums actually enlarge. And there is, the spacing in between the teeth. There would be food lodgement. And again, there would be a lot of other problems. They could even lead to the bone loss. So, this is a much more deeper impact. But I'm just telling you all these, and, a lot of mental health problems like schizophrenia and a lot of other mental problems like the OCD, etc. and, hyperactivity, all these things like the mental problems and, which require medication, all of them have an impact on the oral health. So, we need to actually take care of the oral health as well. And, it is a red flag. If you have some oral health issues that need to be addressed, you need to go to a clinician. and you need to get diagnosed, and you need to see what exactly, is the problem and why such things are actually coming up. Now, I would actually, because of the time constraint, I would just like to even touch upon COVID. Like, now something called as black fungus, which is like, we've been hearing about that all throughout the COVID times, especially in the second wave. Now, this is nothing but a fungal infection. And this this is like, post-COVID. Generally, what happens in the treatment of COVID, many of them are given steroids long-term. Okay, so the effect of steroids, what happens is that the blood sugar levels go up. So even if a person does not have diabetes, the blood sugar level goes up. Now, it's like, you have ants in the kitchen. Now, you drop few sugar levels, you will see it's full of ant. Okay, the similar way, when you have high blood levels, it kind of attracts all the microorganisms. So does fungus, so the mouth is excellent place for you. There is moisture and the fungus grows. So the basic, the symptoms of black fungus is that it causes discoloration of the oral tissues, gums, tongue. It causes stuffy nose, swelling of the face, and there is heaviness below the eyes. And there is discomfort and, headache and fever. And this is very, very fatal, actually. Much more fatal probably than COVID. Okay, if it spreads, and it needs to be taken care of. So of course, even when and sometimes we've seen even patients lose all their teeth at a very young age because of this black fungus, or so because of that, you really need to take care. Now, even about COVID, there have been effects of COVID also. Severe COVID infection actually are associated with xerostomia. Xerostomia is nothing but decreased salivary secretion, because of the hypoactivity of your salivary gland. So there is lesser amount of saliva which is produced in the mouth, and because of which there is dry mouth. Again, another source of the fungal infection. In fact, even COVID has got a lot of oral manifestations. It starts with ulceration in the oral cavity. There could be erosions, there could be hemorrhagic crests, and there could be spontaneous bleeding as well. And in fact, for building up the immunity, what we tell is vitamin C and your B complexes, which are generally given. It also helps in building up your oral health. Okay, and even the mouthwashes, like your betadine mouthwash, actually, because COVID, it starts with this region. So once you use a mouthwash, so locally that infection is killed. So you can actually keep it under control. And in fact, whenever you go out and come, or before stepping out, you can actually just use the mouthwash. And even in fact, this mouthwash, I tell my patients, a drop of it in a diluted form, if you put it in your nostrils also, it gives you complete protection actually for up to 2 to 3 hours. So that is something which even we as clinicians have been practicing before, and even after we come back from clinic, we have been doing that. But like, I would also say that a lot of plus points also happening in COVID times. People have been eating right. Okay, outside junk food is almost off. And people have been drinking a lot of water, warm water. So the number of caries incidents has actually reduced considerably, considering the fact that I have actually been treating a lot of kids. So parents are there at home, they are making sure, kids are eating healthy, etc. So those are a certain amount of, plus things which I do see. So I would like to wind up that, oral health is also as important as, the other health aspects. We need to brush our teeth twice. If you brush your teeth twice, use mouthwashes, I would say 80% of your dental problems would be taken care of. Night brushing is the most important. It's okay if you do not brush your teeth in the morning. Night brushing is really, really important. So take care, stay healthy, and, keep smiling. Thank you.
Thank you very much, Dr. Swati. I think, we have got marvelous insights, from each one of you as the panelists, and I'm deeply indebted to you. In fact, I find it irresistible, to make some statements, which I'm sure, all of us here will understand. You see, I get reminded of, a situation when, Charles Dickens had written his book, A Tale of Two Cities. The current times, are very reflective of that. The first chapter has got some very meaningful lines, and I'm sure, the panelists and the participants will also relate, the current situation to that. It says, it was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epoch of belief. It was the epoch of incredulity. It was the season of light. It was a season of darkness. It was the spring of hope. It was the winter of despair. We had everything before us, unquote. We have everything before us even now. I feel, these kind of insights, really enlighten us, because most of us are, in fact, almost all of us are literate, but we are not educated. The difference between being literate and educated is tremendous, is enormous. We feel with the fragmentary knowledge, the perfunctory knowledge that we have, we can, come out with our do's and don'ts. But when we hear panelists like all four of you, we feel enlightened. Thank you very much. In fact, I would even like to ask a few questions, and I would also like, the participants, if they have got any questions, they could, share those with us. They would send us a mail at support@success-studios.com. support@success-studios.com. Some of the questions which, I have received are, suppose a person has been vaccinated, has undergone 2 shots. Does the person run the risk of getting into this fungus problem? Dr. Ajay, would you be able to tell us?
Yes, actually, see, one thing I like to clarify here is, normally vaccination we say is protective, but nothing is 100% protective, one thing. Second thing is, I have seen few cases, even vaccinated, getting COVID. But one thing for sure is that it decreases the severity. That is another very important myth. People say, I receive vaccine, still I am positive. Yes, you can be positive, because virus does not know that you are vaccinated. Virus will enter your body, but your body has enough immunity to fight the virus. So you will not get severe disease. That is for sure. And second thing, getting virus because of vaccine or after vaccine is not related. Actually, as already been mentioned, that reason for fungus was overuse of steroids. So if you have low immunity, so still you can get a fungal infection. It's not like that. So this is providing specific immunity against COVID virus. But there are numerous regions which can decrease your immunity and you can have fungal infection.
But will that be that fungal infection, will that be as serious as a person who has not undergone vaccination?
Yes, any complication. See, COVID and COVID related complications are tremendously high in non-vaccinated people. So definitely, if you are not vaccinated, you are very vulnerable to have COVID and its consequences.
So the vaccine acts as a major deterrent. Am I right?
Not only major, in fact, I'll say the only and only deterrent is vaccine.
Okay, right. Thank you. Dr. Vasudha, there is a question which I like to pose before you. Ayurveda came under a tremendous criticism, but I do not know. I feel that it was quite unfair to Ayurveda, having been subjected to this kind of a criticism. And even yoga, of course, has been a great thing that has been happening. But what is your take on Ayurveda? Because I don't think it conflicts with any other school of medicine. Vasudha, could you throw some light on this, please?
So, Mr. Saxena, when you say Ayurveda came under criticism, I'd just like to understand in which context you're talking about before I
will tell you that. You see, without it becoming controversial, there was a recent attack, on Ayurveda by some allopathic doctors, and there was a retort also. Now, of course, I believe in both the schools of thought, both the schools of medicine, because I have a lot of faith in Ayurveda in as much as I have a faith in allopathy. I don't think there is any serious conflict. But do you think there is any conflict?
See, Mr. Saxena, there is no conflict. This conflict is probably in our mind, and we need to understand and reflect upon. If we are probably ignorant about what is happening around us, if I, as an Ayurveda or yoga doctor, do not understand what is the strength of modern medicine, it is my ignorance. So you cannot blame this for anybody, vice versa. So if this conflict is arising only because of some lacking of knowledge, because we are not able to understand how we can really work together, And if you really work together, it can really do good. See, finally, what is that? We're all here, for the best cause of humanity. We want people to get well. We want people to, stay healthy. And, finally, that is what any human being would like to be as well. So if we are trying to understand, the strength and weakness of each science and complement it with each other, and that would do, the best thing for the humanity. And if I have to give you an example, see, we work with, say, oncologists. Now I also work with some obstetricians. So there are or gynecologists, for example. So when the doctor feels that the lady is not able to get pregnant, she's unable to conceive, because of different reasons. At times, the first thing they want to attempt is an IUI or an IVF, but the patient is really not ready. Then, if the doctor really understands how Ayurveda and yoga can really contribute and how we can improve the fertility index, and then they can try an IUI, because many times these procedures do fail. And when we start intervening with Ayurveda yoga, we many times use acupuncture as well, or naturopathy methodologies. And parallelly, when we start evaluating the lady and then she goes in for an IUI or an IVF, the success ratio has been quite high. I mean, I just gave you one example. There are plenty like this. So what really matters is how we understand the science and how we complement each other. There shouldn't be any scope to conflict. And that's not what we believe or I believe in.
Yeah, Dr. Vikas, I'll just try to add one thing. Dr. Vasudha rightly said, there is no scope of conflict, both are complementary. And the controversy arises just because of few loose statements by someone, not to name anyone. So it was more or less just a political, I'll say. So there's no controversy. I think difference of opinion will always be there, but I don't think there haven't been any controversy, and both are complementary to each other. That's true.
Thank you very much for allaying such kind of misgivings. Dr. Swati, only one question. You mentioned that people have had less of gum problem. I mean, less of gum problems. Am I right, or was my understanding incorrect?
No, misunderstood. Less of decay.
Less of. Okay.
Yeah. Hello. Yeah, they've had more of gum issues actually.
Okay,
and
more of gum.
less cavities because of the stress, and lack of vitamin D. And, there has been because of the stress, they have the tendency of biting, something called as bruxism and things like that. So, constant tension. They've been on, they've been insomnia, etc. So all of that leads to gum issues, which people have been having.
Thank you. Sonali, I wanted if you could just throw some more light on the mindset part of it, please. Sonali?
Yeah.
Because it's a very important thing, so I'm sure, you can share some reflections on this, please.
Absolutely. So, in fact, today I had a guest with me who has been dealing with cancer. And what she said is that in spite of all her ailments, what has really helped her is to come to terms with the fact that, in spite of 1 billion population, she is one of the chosen ones for this deadly disease, right? And what has really helped her come out of it, though she has gone through 2 surgeries, she is practicing on a regular basis affirmations. So affirmations are nothing but statements which you utter on a regular basis during the day. Let's say you want to say that I'm completely healthy, I'm doing fine, and everything around me is looking great, right? This is something like we practice, our yoga, and of course, like our eating habits and hygiene. We need to practice our mental routine as well. How do we get in touch with ourselves in a positive frame of mind? When I look at myself, do I say that, oh my God, why has this befallen on me? Why me, right? Instead of that, one has to be very strong while dealing with any such, kind of ailments or concerns in life. So one part is affirmation. The second part is visualization. Very often, so there is a science which says, and of course, Vikas, you hailing from HR fraternity and having, interacting with employees on a regular basis, you do a lot of counseling, mentoring yourself. Right. So as a part of our profession, we face on a regular basis that even if a person is completely healthy, just by visualizing wrong situations, that, oh, am I going to get fired? Is there a situation where I'm going to, lose my clients? These are certain things which create a kind of phobia in a person. And that in turn can cause a lot of damage to your physical system. Right. So one has to exactly. So one has to really practice on a regular basis being positive and visualization of the things that they would like more in life. All of us in life are surrounded by beautiful things as well as not so great things. Right. Now, how much are we practicing that? Okay, what do we want? What are we attracting? So if you read about LOA, that is law of attraction, you get what you are constantly thinking about, right? So it's imperative that we start thinking of things that we want in our life. There is a research, like I was mentioning, that we think at least some 1,000+ negative things in our heads every day. So unless we are conscious about, like Dr. Swati mentioned, that we need to have that hygiene and we need to ensure that all these things are in place. It's just the mouth, right? But even then, we regularly brush our teeth. But are you regularly cleansing your mind and soaking it with thoughts which can make your life beautiful? So long story short, affirmation, visualization, interacting with people who are not a burden in your kind of way of thinking of life. These are very, very critical, along with your vaccine, along with right food habits, along with yoga. And of course, I would highly recommend Ayurvedic systems, because, this is an ancient science which has not only been in our, Vedas and Upanishads for years together, but it has helped us in kind of, like now, people abroad in US, UK, all over the world, they are adopting our systems, and we are not even acknowledging and appreciating our ancient science. So it is high time we do that. And last but not the least, like Ajay just mentioned, that the vaccine is one of the biggest important things, because a lot of us have had this doubt whether we should have this at all or not. Right. In fact, I myself had a lot of, kind of thinking and rethinking before I actually took the vaccine. So my recommendation is, along with your lifestyle change, along with your mental habits, and also taking care of yourself on a day-to-day basis, mind, body, and soul, that's the only way to nurture health on a regular basis. If that answers your question.
After all, my question is answered beautifully well, and I think all roads lead to Rome. What I gather from this session is, great ideas, in the sense that we get, I learned something: to cogitate, to mediate, to meditate, to iterate, to ideate. I think this has been the summum bonum of this particular session. Thank you very much, Sonali, for having organized this. And I would really like to thank the panelists and the participants. Thank you very much. I look forward to working with all of you again in the sessions which Success Studios will be organizing from time to time. Thank you very much. Good night.
Thank you.
All the best.
Thank you. Thank you to each one of you, and thank you, Vikas. Thank you.
Thank you, Sonali. It was
Thank you
wonderful.
very much.
Pleasure. Thank you.
Thanks.
Bye-bye.
Thank you.
Bye.
Thank you.